Module 4.2. As a reminder, it's recommended to print the video script and annotate the script while watching the video for later use. Video scripts are available on Canvas. Module 4.2. How do researchers formulate good research questions? One of the goals of biostatistics is to promote the idea of evidence-based practice. According to Wikipedia, an evidence-based practice, or EBP, is any practice that relies on scientific evidence for guidance in decision-making. Practices that are not evidence-based may rely on tradition, intuition, or other unproven methods. The first step in evidence-based practice is to formulate well-written research questions. If we want to use data to learn from, we must first determine what we would like to learn. The PICO process. This process is a mnemonic that can help formulate and answer healthcare-related questions. The acronym stands for P, patient, problem, or population. What is the type of patient's population or problem you are interested in learning about? I, intervention or exposure. What intervention or exposure are you considering? C, comparison or control. What will you compare the intervention or exposure to? O, outcomes. What do you plan to measure, improve, or affect? The following example comes from the link given in the script. So, for example, we could fill out the process to formulate a research question. Located on the right-hand side of the table are the research interest. On the left are the different pieces of the mnemonic. So for P, for the patient, population, or problem, we have that the research interest is rising levels of drug overdose deaths in the Michigan population. For I, intervention, the research interest is to incentivizing primary care doctors to prescribe non-opioid painkillers. C, for the comparison, notice here, in this case, you might want to have an implicit comparison, meaning you're asking whether the intervention is more effective than doing nothing. O, for the outcome, we would like to see statistically significant reduction in deaths caused by drug overdose in Michigan. Once you've filled out the table, you should be able to formulate a good clinical question. For the example above, the resulting research question might be, can incentivizing primary care doctors to prescribe non-opioid painkillers significantly reduce the rate of death by drug overdose in Michigan? So by using the mnemonic, we can formulate good research questions that contain all of the necessary pieces. We've identified the patient, problem, or population we're interested in, what type of intervention or exposure, what we're going to compare that intervention or exposure to understand if it's working, and then how we're going to measure the outcomes. There are several good guides to help with this process. Listed in the script are these 4 links. Other good advice on formulating research questions. The libraries at the University of Michigan offer some good advice when formulating research questions. You can find this information by following the link given in the script. You can use the acronym FINER to help you think about what is important in designing a good research question and posing good research questions. FINER stands for the following. Feasible. A good research question has to be possible to reach within the span of the time you have and using the resources you have. If you have only a semester or 2, think about how you narrow your research question so that you can complete it within the time you have. Interesting. A good research question will be about a topic that contributes to the purpose of your field. Your research will be about improving and promoting public health, so any question you ask has to be related to that goal. Novel. Don't reinvent the wheel. Even if you are very interested in a particular question, don't research it if someone else already has, unless you think you can provide a new insight on what was already known. Ethical. There are many research questions that would be feasible, interesting, and novel to investigate, but might endanger your research participants. This could be because they are asked to reveal sensitive information that could impact their lives negatively, because they aren't given the benefit of a treatment that's already been known to be effective, or because the participation in the study itself might be harmful. For example, even though public health is interested in issues of drug addiction, it would be unethical for researchers to interview subjects who are currently using illegal substances if doing so could get the subjects arrested or imprisoned. Relevant. Relevance is like a more specific kind of thinking about why your research is interesting to other people in your field. How will the answer to your question specifically help patients or practitioners? For example, you might want to look at how body weight is discussed or portrayed in a particular teen magazine. When you think about your research question, you want to think about who the information will help. Will it help primary care doctors talk about body weight with teenage patients? Will it help people to design better treatment programs for teen patients with eating disorders? If you can't think of any patient or practitioner group that could potentially find your research useful, your question may not be a relevant one. Research questions and epi-profiles. Recall the following. An epidemiologic profile is a document that describes the burden of disease on the population of an area in terms of socio-demographic, geographic, behavioral, and clinical characteristics of persons with a disease of interest. The profile is a valuable tool that is used at the state and local levels by those who make recommendations for allocating disease prevention and care resources, planning programs, and evaluating program and policies. This is adapted from the CDC guidelines for HIV epidemiological profiles. For an epi profile, there are 3 essential questions that you need to address. What are the socio-demographic characteristics of the general population in your service area? What is the scope of the burden of the disease in your service area? What are the indicators of risk contracting the disease in the population covered by your service area? After this video, look through pages 33 through 53 of the CD guidelines for HIV epi profiles for what these questions would look like for an epi profile detailing HIV. This will inform you of what types of information to look for when addressing these types of questions in your epi profile. This concludes the Module 4.2 video.